Hello, everyone, and welcome to Tasha P. Styles University. My name is Tasha, and I'm the licensed cosmetologist that will be leading your class. I'm excited that you decided to choose my class to join to boss up to your next level. In this course, you will get at least 16 hours of health and hygiene required by the state of Tennessee to become a certified hair braider. And with this certification, you'll be able to shampoo, twist, wrap, weave, extend, lock, or braid the hair. So let's start with a little bit about me. I absolutely love what I do. I've been licensed cosmetologist for over 10 years now, and I've been braiding since I was about 7 years old. And I'm super excited to help you go to your next level. Let's go. Becoming a certified hair braider, you'll be working in the cosmetology field. This is why it's a must that we discuss health and hygiene. It's about more than braiding the hair. Although we want our clients to feel good, we want to do so without compromising the integrity of their hair. So we'll start with sanitation. Sanitation is simply cleaning the objects by removing all visible dirt and debris. By cleaning surfaces properly, we reduce the number of germs and we reduce the risk of infections. We need to remove all dirt and debris from combs and utensils, and Ship Shape is a perfect cleaning product to start off with. Washing hands is one of the most important things you can do. This procedure helps control infections. Every state requires that hand washing before services are performed. Next, you'll see the four simple steps on how to properly wash your hands. Make sure that you're using warm water, you wet your hands properly, you let them lather for about at least 20 seconds. You need to make sure you have a nice clean brush to get underneath those nails, a proper towel or paper towel to dry your hands, and then make sure that you're using those items to turn the water off when done. Next up is personal hygiene. You may wonder, why would we need to talk about personal hygiene? Well, let me just start off with a little story. I was teaching. I had a student that was from a different country. Their personal hygiene was just a little different from ours. She didn't realize that she was being offensive. In this field, we're very close up with one another. Basic hygiene practices such as bathing or showering should never be omitted from the daily personal care practices. Personal hygiene is the maintenance or cleanliness of practicing good health habits. Working as a stylist, makeup artist, braiding practitioner, you'll be in close proximity with the clients. One weak moment of drinking coffee right before performing a service or wearing something that needs laundering because you didn't plan ahead could be disastrous. Rather than telling you that you smell offensive, most clients will simply just not come back or tell someone else about their horrible experience. Some of the best ways to make sure that we are fresh and clean every day is to just make sure that you have toothbrush and toothpaste at your workplace. Pack some mouthwash. Keep a little hand sanitizer there. Maybe some dental floss, maybe even deodorant or anti-wipes. And to make sure that we have good hygiene through the day, it's awesome that you wash your hands throughout the day before and after every client. Perform self-checks. Wash under your arms often as needed. Sometimes you have to keep a change of shirt. You never know if it's going to be hot in a place or cold in a place. You could start sweating. And if you're a cigarette smoker, try to keep a toothbrush or mouthwash on hand. This just helps keep you fresh, and keeping mints and gum is awesome as well. Next up, we're going to talk about how to provide proper and effective shampoo services. Next, let's talk about shampooing. This to me is one of the most important parts of your service and you providing a service. Making sure that the scalp is clean is a wonderful thing to do, but it's more than making sure the scalp is clean. You want to make sure that there is nothing wrong with the head, like lice or ticks. You want to make sure that there are no scalp disorders that you can see, no open wounds, or no scalp irritations. These things can affect your service, and not knowing how to properly shampoo or to even offer the shampoo service prior to you starting any braids, twists, locks, or sew-ins could be detrimental, and it could really cause a problem with your business. If there are any open wounds, redness of scalp, irritations, abnormal flaking, or appearance of infections, immediately direct that client to a physician and do not continue the service. One of the best things about shampooing the hair at the salon is this is time for you to educate your client. You can educate your client about the importance of home care and suggest the best things for them to do, how long to keep the service, and when it's time to come back. Now let's talk about understanding the principles of infections. Now, being a salon professional, it can be fun and rewarding, but there comes great responsibility. One careless action could cause an injury or an infection, which is an invasion of the body's tissues by disease-causing pathogens. If your actions result in an injury or infection, you could lose your license and ruin the salon. Fortunately, preventing the spread of infection is easy when you use the proper procedures and follow them at all times. Cosmetologists must understand and remember that there are 4 types of microorganisms: bacteria, viruses, fungi, and parasites. Under certain conditions, many of these organisms can cause infectious diseases, and infectious diseases are caused by pathogenic, which are harmful organisms that enter the body. An infectious disease may spread from one person to another. This is why we need to learn how to properly clean and disinfect tools and equipment that we use in the salon for our safety and the clients. To clean is a mechanical process of scrubbing using soap and water or detergent and water to remove all visible dirt, debris, and many disease-causing germs from tools, implements, and equipment. The process of disinfection is a chemical process that destroys most, but not necessarily all, harmful organisms on the environmental surfaces. The pathogens of concern in the cosmetology industry are effectively destroyed by the disinfection process, which is required in all states. Infection can be transmitted through contaminated salon tools and equipment if proper disinfection steps are not taken after every service. You are a professional now. You have a legal obligation to protect your clients from harm by using proper infectious control procedures. If clients are affected or harmed because you performed infectious control procedures incorrectly, you may be legally responsible for their injuries of infection. Bacterial infections. There can be no bacterial infections without the presence of pathogenic bacteria. Therefore, if pathogenic bacteria are eliminated, clients cannot become affected. You may have clients who have inflammation, a condition in which the body reacts to injury, irritation, or infection. An inflammation may be characterized by redness, heat, pain, or swelling. Pus is a fluid contained with white blood cells, bacteria, dead cells, and is the byproduct of an infectious process. The presence of pus can be a sign of a bacterial infection. A local infection, such as a pimple or abscess, is confined to a particular part of the body and appears as a lesion containing pus.
When a disease spreads
A
from one
systemic
person to
infection
another,
is an
it's
infection
called
where the
contagious,
pathogen
also
has
known as a
distributed
communicable disease.
throughout the body or
Some
the
of the
system
more
of the
common
body
contagious
rather than
diseases that
staying in one area or
prevent
origin.
salon professionals
Staphylococcus,
from
among the
performing a service
most
on a
common
client are a
bacteria
common
affect
cold,
humans, are
a
commonly found
ringworm,
in our environment,
conjunctivitis, which
including
is
on our
pink eye,
bodies, although most
viral
strains do not
infections.
make us ill. Staph
The
bacteria can
most
be
common
picked
of
up
these
on
infections
doorknobs,
are spread through
countertops,
dirty
and other
hands,
surfaces,
especially
but in the
under the
salon they are
fingernails
frequently spread through skin-to-skin
and between the
contact,
webs of the
such as
fingers.
shaking a hand,
Be sure to always wash your
or
hands
through the use
before
of
and after
unclean
using the
tools or
restroom and before
implements.
and after eating.
Although lawsuits are rare
Contagious
concerning the
diseases can
number of
also be
services performed
spread
in
by
performed
contaminated
in a salon,
implements,
every
cuts,
year many
infected
salons are
nails,
sued
open sores,
because of staph
pus,
infections.
mouth and nasal discharge, shared drinks cups, telephone receivers, and towels. Uncovered coughing or sneezing or spitting in public also spreads germs. Viruses. Let's talk about viruses. Viruses are submicroscopic particles that infect and reside in the cells of biological organisms. Viruses are so small that they can only be seen under the most sophisticated and powerful microscopes. They are caused they cause common colds and other respiratory infections. Some of the viruses that plague humans are measles, mumps, chickenpox, smallpox, rabies, yellow fever,
Hepatitis, polio, influenza, and HIV, which causes AIDS.
Bloodborne pathogens are microorganisms that are carried through the blood or bodily fluids, such as hepatitis and HIV. In a salon, the spread of bloodborne pathogens is possible through hair cutting, burns, shaving, nipping, facial treatments, tweezing, waxing, or whenever the skin is broken.
Hepatitis is a blood-borne virus that causes diseases that can damage the liver. In general, it is difficult to contract hepatitis. Unlike HIV, hepatitis lives on surfaces outside of the body for long periods of time. For this reason, it is vital that all surfaces that come in contact with clients are thoroughly cleaned and disinfected. Human immune deficiency virus, also known as HIV, is the virus that causes AIDS. AIDS is a disease that breaks down the body's immune system. HIV is spread from person to person through blood. A person can be affected with HIV for many years without having symptoms, but testing can determine whether the person is infected within 6 months after exposure to the virus. Sometimes people who are HIV positive have never been tested and do not know that they have the potential of infecting other people. The HIV virus is spread mainly through the sharing of needles. Less commonly, HIV is spread through accidents with needles in healthcare settings. It is not spread by holding hands, hugging, kissing, sharing food, or using household items such as the telephone or the toilet seat. There are no documented cases indicated that the virus is spread through food handlers. If you accidentally cut a client, the tool is now contaminated with whatever might be in the client's blood, including HIV. You cannot continue to use the implements without cleaning and disinfecting it. Continuing to use contaminated implements without cleaning and disinfecting puts you and others at risk of infection. Now let's just do a little review about the proper uses of disinfection. Implements must be thoroughly cleaned from all visible matter of residue before being placed in disinfectant solution. This is because residue will interface with the disinfectant and prevent from proper disinfection. Properly cleaned implements and tools, free from all visible debris, must be completely immersed in disinfection solution.
Complete immersion means there is enough liquid in the container to cover all surfaces of the items being disinfected, including the handles, for 10 minutes or for whatever time recommended by the manufacturer. Did you know that all disinfectants, including bleach, are inactivated, which means made less effective, in the presence of many substances, including oils, lotions, cream, hair, skin, nail dust, and nail filings? It is critical that you use soap or detergent first to thoroughly clean all equipment and remove debris. Never mix detergents with disinfectants and always use a well ventilated area.